visible, students? Okay, sorry. Yes, students, good morning to all of you. And we're discussing the femoral nerve. We're discussing the femoral nerve. For that, first let us first understand, just one moment, the anterior, let me just adjust this. The anterior compartment of the thigh, and then we'll discuss the femoral nerve for you, femoral nerve. Okay, so here we start. I'm Dr. Pradeep Pawar, Professor of Anatomy, and I've been teaching anatomy since the last 21 years, mentoring the students for their postgraduate entrance exams. Okay, so now starting with the anterior compartment of the thigh. Come on, students. Anterior compartment of the thigh. In the thigh, we've got three compartments. One is anterior, one is posterior, and one is the medial compartment. Anterior, posterior, and medial compartment, right? And in three compartments, we've got three nerves. The nerve of the anterior compartment is the femoral nerve. The nerve of the medial compartment is going to be the obturator nerve, and the nerve of the posterior compartment is the sciatic nerve. So this is specially focused for the first year prof students. Understanding the muscles, okay, it will be equally important for the rest of you also. So you can all attend this lecture, understand the concept. Yep. So starting with the anterior compartment of the thigh. What is this muscle here in the anterior compartment? What is this muscle here in the anterior compartment? Here, look at this muscle. And this muscle is the sartorius. Now, what is the origin of sartorius? It begins from the anterior superior iliac spine, right? Begins from the anterior superior spine. It crosses the hip joint from the lateral to the medial side, right? It crosses the hip joint from the lateral to the medial side. It crosses the knee joint also. It crosses the knee joint. It is inserted on the medial aspect of the shaft of tibia. Medial aspect of the shaft of tibia. So, sartorius originates from the anterior superior iliac spine. It crosses the hip joint from the lateral to the medial side, crosses the knee joint, and it is inserted on the medial aspect of the shaft of tibia. If you can just tell me, there are three muscles inserted on the medial aspect of the shaft of tibia. Which are those three muscles? One is the sartorius. That's from the anterior compartment. Gracialis, and that's from the medial compartment, and one is the semitendinosus, and that's from the posterior compartment. So now you tell me, there are three muscles inserted on the medial aspect of the shaft of tibia. The sartorius, the gracialis, and the semitendinosus. Together, these three muscles are known as what? The gyropes. These three muscles are known as the gyropes. Okay, gyropes. And what is the function? They support the femur. On the tibia. Okay, so these are known as gyropes. The sartorius, gracialis, and semitendinosus. And together, when these three muscles are inserted on the tibia, they are separated from the tibia by a bursa. There's a bursa which separates them, and this is what we call as the anserine bursa, right? So the anserine bursa separates the insertions of the gracialis, semitendinosus, and sartorius from the tibia. So what is the origin of sartorius? Origin of sartorius is the anterior superior iliac spine. Insertion of sartorius is on the medial aspect of the shaft of tibia. This is a very important muscle, okay? Medial aspect of shaft of tibia. So now you tell me, when this muscle is going to contract. Okay, I'll clear the slide. Tell me now, when this muscle is going to contract here, when this muscle is going to contract, yeah, I'll start. Now when this muscle contracts, what happens? It takes the thigh outwards. So what is that? Abduction. It turns the thigh laterally, it turns the thigh outwards. What is that? Lateral rotation. And it also takes the thigh upwards. It causes flexion at the hip joint. So what is the action of Sartorius on the hip joint? On the hip joint, it would be abduction, lateral rotation and flexion. Abduction, lateral rotation and flexion at the hip joint. And what is the action of Sartorius on the knee joint? On the knee joint, it causes flexion and medial rotation. Flexion and medial rotation at the knee joint. Okay, so I'll just put this on the paper for you. What is the action of Sartorius? This is a very important MCQ. This is a very important thing which is asked in Viva. Actions of Sartorius on the hip joint is abduction, lateral rotation, abduction, lateral rotation and flexion. Abduction, lateral rotation and flexion at the hip joint, and flexion and medial rotation at the knee joint. Flexion and medial rotation at the knee joint. Clear to all of you? So this is abduction. So there's a common action of those three muscles which are inserted on the tibia. They have a common action on the tibia. The Sartorius, the gracialis and the semitendon muscles. The common action is what? They cause flexion at the knee and they also turn the knee medially. Flexion and medial rotation at the knee joint. So clear to you, all of you students, what is the action of Sartorius on the hip joint? Abduction, lateral rotation and flexion at the hip. And what is it on the knee joint? Flexion and medial rotation at the knee joint. Okay, so that's the action of Sartorius. Now coming back to this next muscle in the anterior compartment of the thigh, which is the next muscle. Look, this is a straight muscle of the femoral region. Tell me students, anything straight is known as what? Rectus. And this is what we call as the rectus femoris. Okay, so this is what we call as the rectus femoris. Now this rectus femoris has got two heads. It has got two heads. One, no, this is not seen. Rectus femoris के दो heads होते हैं. One is the straight head and the other one is the reflected. This is not seen. I'll put this white screen for you. So rectus femoris has got two heads. One is the straight head and the second one is the reflected head. Where does the straight head of rectus femoris begin from? It begins from the anterior inferior iliac spine. And where does the reflected head begin from? It begins just above the acetabulum. That's the reflected head of rectus femoris. Okay, I'll just write this down for you. Rectus femoris. This is another important muscle. Rectus femoris. इसके दो heads हैं. There are two heads for this. One is the straight head and the other one is the reflected head. Now, where does the straight head begin from? It begins from the anterior inferior iliac spine, and the reflected head begins above the acetabulum. Okay. Now that's the rectus femoris. The second muscle is vastus medialis. Vastus lateralis. Good morning. Vastus lateralis and vastus intermedius. I'll show you the slide. So four muscles, a set of four. Yes students, a set of four is therefore known as what? Quadriceps femoris. So which are the four muscles included in quadriceps femoris? One is a straight muscle. What's that? The rectus femoris. The second is the vastus medialis, vastus lateralis and the vastus intermedius. Vastus intermedius lies below the rectus femoris. So together a set of four, and this is what we call as the quadriceps femoris. Together this is what we call as the quadriceps femoris. And where is this quadriceps femoris inserted on? It is inserted on the base of patella. Okay, it is inserted on the base of the patella, right? And what begins from the patella, there's a ligament. Let's see if this is the patella here, if that's the patella. The insertion of quadriceps femoris is on the base of the patella. And what begins from the patella here is the ligamentum patellae, which is inserted on the tibial tuberosity. So it is inserted on the base of the patella, and what begins from here is the ligamentum patellae, inserted on the tibial tuberosity. I've just written in short. So that's the ligamentum patellae, which is inserted on the tibial tuberosity. Clear to all of you? Students, are you following? Good morning once again to all of you. Are you following this? So this, what are we discussing, is the anterior compartment of the thigh. So to explain the femoral nerve, I first have to tell you the muscles in the anterior compartment of the thigh. The first muscle which we have discussed is which one? The Sartorius, right? The second muscle is the straight muscle. What is this? That's the rectus femoris, a straight muscle, rectus femoris. Now this is the vastus medialis, this is the vastus lateralis, and if you remove the rectus femoris, इसके नीचे क्या होगा? Below this is going to be the vastus intermedius. Look at this. This is vastus intermedius. Together, a set of four is known as what? The quadriceps femoris. And this quadriceps femoris is inserted on the base of the patella. Look at that. It's inserted on the base of the patella. And what begins from here is the ligamentum patellae. And this ligamentum patellae is attached to the tibial tuberosity. Clear, students? It is attached to the tibial tuberosity. Now tell me, what is the action of quadriceps femoris on the knee joint? What is the action of quadriceps femoris on the knee joint? It's in front of the knee joint, so it does extension of the knee joint. Okay, and out of this quadriceps femoris, there's only one muscle which is going to act on the hip joint. Which is that muscle which acts on the hip joint? The rectus femoris, because the rectus femoris is going to cross the hip joint, right? It crosses the hip joint. So who's going to also act on the hip joint? The rectus femoris. And what is the action of rectus femoris on the hip joint? It will cause flexion at the hip joint. So clear? So action of quadriceps femoris, when you answer this for the viva, acting as a whole, this muscle is going to cause extension at the knee joint, and the rectus femoris alone would cause flexion at the hip joint. Rectus femoris alone would cause flexion at the hip joint. Clear? So that's the total muscles in the anterior compartment of the thigh. Look at this MCQ and answer. All the following statements concerning the Sartorius muscle are correct, except it is known as Taylor's muscle. Yes, it is known as Taylor's muscle. It's the longest muscle in the body. Yes, the longest muscle. It acts on two joints. What do you say? Yes, correct. It acts on the hip joint, and it also acts on the knee joint because it crosses both the joints. So it acts on both the joints. It extends the hip. This is wrong. It doesn't extend the hip. It is going to flex the hip joint. ये आगे होता है. It's in front, so it is going to flex the hip joint. Am I clear? So that's about the Sartorius. Answer this. A very important MCQ, rectus femoris causes. So rectus femoris, out of those four quadriceps, is going to act on the hip as well as on the knee joint. So what is the action of rectus on the hip joint? Flexion at the hip joint. And what is the action on the knee joint? Extension at the knee joint. Okay, so flexion at the hip and extension at the knee joint. Is this clear to all of you? Fine. Okay, so that's about the anterior compartment of the thigh muscles. Okay. Now, before that, I'll tell you this. Now, extension at the knee joint. Just understand this. And now, you're sitting on the chair, or you're sitting on the chair and watching this video. So when you're sitting on the chair, your knees are like this. No? Your knees are flexed like this. Your tibia and your femur. So the knee is flexed like this. Your position of knee is like this. Now when we stand up, when you're going to stand up, when you keep the foot on the ground. Okay, when you place the foot on the ground and when we are extending the knee joint, we are doing an extension at the knee joint. Now what happens? Look, now when we extend the knee joint, the lateral condyle of femur articulates with the lateral condyle of tibia. The lateral condyle of femur fits into the lateral condyle of tibia. They are of the same diameter के होते हैं, so they fit into each other. But the medial condyle of femur is larger in diameter. It's wider and it's larger in diameter. So when we extend the knee joint, what happens? The lateral condyle of femur fits into the lateral condyle of tibia. But the medial condyle of femur is larger in diameter. It is not articulated till now. अब तक ये articulate नहीं हुआ है. At this point of time, what does the femur do? The femur undergoes this. What is this? A medial rotation. And this is what we call as the locking of the knee joint. Okay, so this is what we call as locking of the knee joint. So what is locking? Locking is the medial rotation of femur during the final stages of extension when the foot is on the ground. Understanding? So when we are extending the knee joint, the lateral condyle of femur fits into the lateral condyle of tibia, but the medial condyle of femur is larger. For this to articulate, the femur has to undergo a medial rotation, and this is what we call as locking of the knee joint. Locking. So locking of the knee joint is the medial rotation of femur during the final stages of extension when the foot is on the ground. I hope this is clear to all of you. Yes, I'll just write this for you. Locking of the knee joint, a very important short note, a very important MCQ. And who helps in locking? The muscle which causes extension at the knee joint would help in locking of the knee joint. Tell me, who's an extensor of the knee joint? The quadriceps femoris. Very good. And hence, locking is done by whom? The quadriceps femoris. Right? I'll just write this for you. Locking of the knee joint. Locking of the knee joint. It's the medial rotation of femur during the final stages of extension when the foot is on the ground. When the foot is on the ground. Clear? So medial rotation of femur during the final stages of extension when the foot is on the ground. Clear to all of you? Any doubts? Any doubts you have? Till here, any doubts you have, you let me know. I hope this is clear to all of you. So that's about the anterior compartment of the thigh, the muscles. Easy, and 1 Sartorius and 4 Quadriceps Femoris. Now you know the origin, you know the insertion of Sartorius as well as the Quadriceps Femoris. Now, which is the nerve which is coming to supply this muscles? Which is the nerve which is coming to supply this muscles? Have a look. Okay, answer this MCQ. Locking of the knee joint occurs due to. Locking of the knee joint occurs due to. Yes, students, answer. Locking of the knee joint occurs due to. Yes, anyone? Yes, Mohan Singh, answer. It's the medial rotation of femur during the last degrees of extension. The medial rotation of femur during the final stages of extension or the last stages of extension. So that is locking of the knee joint. Okay, clear to all of you. I hope this is clear. Okay. Now, coming to the nerve. Tell me, which is the nerve of this compartment? Which is the nerve of this compartment? The nerve of this compartment is the femoral nerve. Femoral nerve. Arey, awaaz mat kar, Kailash. The nerve of this compartment is the femoral nerve. Femoral nerve. So, femoral nerve. Come on, let us discuss something about the femoral nerve. Femoral nerve is a branch of what plexus? What is that plexus? That's the lumbar plexus. Lumbar plexus. So, femoral nerve is a branch of lumbar plexus. Lumbar plexus. What is the root value of femoral nerve? The root value of femoral nerve is L2, L3, L4. L2, L3, L4. Tell me, any nerve is formed by what? It is formed by the ventral ramus. Ventral ramus. Okay, I'll just make this for you. So, ventral ramus, look at this. Yeah. So, ventral ramus would divide into a dorsal division and a ventral division. Dorsal division and ventral division. So, dorsal division of ventral rami of L2, L3, L4. This is femoral nerve. And the ventral division of ventral rami of L2, L3, L4. Any guesses? What is this? This is going to be the obturator nerve. So, what is the root value of femoral nerve? Femoral nerve is formed by the dorsal divisions of the ventral rami of L2, L3, L4. The dorsal divisions of the ventral rami of L2, L3, L4. That's femoral nerve. And what is the root value of obturator nerve? It is formed by the ventral divisions of the ventral rami of, ventral divisions of the ventral rami of L2, 3, 4. That's the obturator nerve. So, femoral nerve is the largest branch of lumbar plexus. I'll just write it like this: largest branch of the lumbar plexus. I'm starting with femoral nerve. Okay, largest branch of lumbar plexus, formed by the dorsal divisions of the ventral ramus of L2, L3, L4 lies in the iliopsoas groove. It lies in the groove between the iliacus and the psoas major. We call this as the iliopsoas groove. Lies outside the femoral sheath. It lies outside the femoral sheath. What happened? Didn't understand? What happened? Are you following this or no, all of you? That's why I'm asking in between. Is this clear or no? So, femoral nerve. Tell me, femoral nerve is the largest branch of lumbar plexus. Now, what is this lumbar plexus and all that we'll discuss later. So, it's the largest branch of lumbar plexus. What is the root value of femoral nerve? It is formed by the dorsal divisions of the ventral rami. This I'll tell you when we are discussing the lumbar plexus. Okay, the dorsal divisions of the ventral rami of L2, L3, L4. Now, it lies in the iliopsoas groove. It lies outside the femoral sheath. Okay. Now, it has a trunk. I'll revise this quickly. It has a trunk. Anterior and posterior division. This is the easiest way to understand the femoral nerve. एक trunk होता है and दो divisions होते हैं, anterior and posterior divisions. It has a trunk, anterior and posterior divisions. I'll revise this, don't worry. I'll just quickly go through it. Clear? This much is clear? So now what are the branches of femoral nerve? Understand this. What are the branches of femoral nerve? Now this thing I can't show, once it is gone, it's gone, so just write it fast. So what are the branches of femoral nerve? I make this as the trunk of femoral nerve. I make this as the anterior division and the posterior division. Okay, this is the trunk of femoral nerve. This is the anterior division of femoral nerve, and that's the posterior division of femoral nerve. So what are the branches from the trunk of the femoral nerve? From the trunk it gives two branches. One is nerve to iliacus, and the second one is nerve to pectineus. nerve 2 iliacus and nerve 2 pectineus. So branches from the trunk, there are two branches. One is nerve 2 iliacus and the second one is nerve 2 pectineus. Anterior division gives two branches. It gives one muscular branch and it gives two cutaneous branches. One muscular, two cutaneous branches. One muscular branch is given to Sartorius. And two cutaneous branches. What are these cutaneous branches going to supply? They supply the skin on the medial aspect of the thigh. The skin on the medial aspect of the thigh. What do you call this as? The medial femoral cutaneous nerve of thigh. Medial femoral cutaneous nerve of thigh. And the anterior femoral cutaneous nerve of thigh. I'll show you this. Anterior femoral cutaneous nerve of thigh. So it gives two cutaneous branches. One is the medial femoral cutaneous nerve of the thigh and the second one is the anterior femoral cutaneous nerve of thigh. Okay. So look at this. I'll show you this because once I clear this nerve, it doesn't come back on the screen. It is gone forever. So what are the branches of the anterior division of femoral nerve? It gives one muscular, two cutaneous branches. One muscular branch is given to Sartorius and two cutaneous branches. One is going to supply the skin on the medial aspect of the thigh and the other one is going to supply the skin on the anterior aspect of the thigh. So that is the medial femoral cutaneous nerve of thigh, anterior femoral cutaneous nerve of thigh. Okay, now coming to the posterior division. What are the branches from the posterior division? Posterior division gives, again, it gives four muscular branches, four muscular and one cutaneous branch. Four muscular and one cutaneous. Four muscular branches are given to Quadriceps Femoris. Four muscular branches are given to Quadriceps Femoris, one cutaneous branch, and that is known as the Saphenous nerve. One cutaneous branch is known as the Saphenous nerve. Now, what is Saphenous nerve and all? That we'll discuss later. Clear to all of you? So this is about the femoral nerve. Femoral nerve has got a main trunk. It has got two divisions. The femoral nerve is a branch of the lumbar plexus. These are all very, very important MCQs for you. This is all asked in 5 hours. So it's the largest branch of lumbar plexus. And what is the root value of femoral nerve? It is formed by the dorsal divisions of the ventral rami of L2, L3, L4. The femoral nerve lies in a groove between two muscles, the iliopsoas groove. The femoral nerve then lies outside the femoral sheath. Now, what is femoral sheath and all? I'll tell you later. Just remember the femoral nerve is outside the femoral sheath. It has a main trunk and two divisions, anterior and posterior. So, what are the branches from the trunk? One is the nerve 2 iliacus and second is the nerve 2 pectineus. The anterior division gives one muscular, two cutaneous branches. One muscular branch to the Sartorius and two cutaneous branches are the medial and the anterior femoral cutaneous nerves of thigh. So it supplies the skin on the medial and the anterior aspect of the thigh. Clear? The posterior division gives four muscular and one cutaneous branch. Four muscular branches are given to Quadriceps femoris and one cutaneous branch, that's the saphenous nerve. It's the largest cutaneous branch of femoral nerve. It's the largest cutaneous branch of femoral nerve. And what is the saphenous nerve supply? I'll just mention this for you. This is very important. Now this saphenous nerve is going to supply the skin on medial aspect of the leg. Medial aspect of the leg, skin on the medial aspect of the leg and the foot up to the great toe. Skin on the medial aspect of the leg and the foot up to the great toe. It doesn't supply the great toe, okay? It doesn't supply the skin of the great toe. Clear to all of you? So that's about the femoral nerve. I'll just show you the slide here about the femoral nerve. So this is about the anterior compartment of the thigh and the femoral nerve. Before we go to the other, just 1 minute. Before we go to the other things, so a brief about our platform. Now we've got a plus subscription in which you have got access to both recorded and live classes. You've got the top educators to teach you. You've got live quizzes. And we've got a question bank of about 2,500 MCQs, and we're soon coming with printed note for 1 year subscription and above students, right? We've got an iconic subscription where you've got the best of Unacademy, the lectures and the pre-planned notes. Okay. Special classes in which you've got interactive live classes where you can interact with the educator. You've got polls for the learners. You've got raise a hand technique wherein when you press the icon you can directly talk with the educator. Never miss a class, you get notifications, and lecture notes you will be getting in PDF form, and anywhere, anytime you can attend these classes. Now, a highly updated and effective question banks of about 25,000 curated MCQs are there for you, highly yield clinical MCQs. Okay, and we've started with some new batches from this month. We've started with FMG batch, we've started with second year professional batch, target 2023 batch, and a high fast track revision batch. 1 month package for the, especially for the PG students. We have started for this PG entrance. We have started, and download the Unacademy app. Okay, students, is this clear? Just a quick revision. What I have told you today. We have discussed. Okay, we have discussed the anterior compartment of the thigh, and we have discussed the femoral. Now, once again, a brief go through it. Anterior compartment of the thigh, the muscles are, one is Sartorius, the second is the Rectus Femoris, the Vastus Medialis, the Vastus Lateralis, and the Vastus Intermedius. A quick go through it. Sartorius, the origin is from the anterior superior iliac spine. It crosses the hip joint from the lateral to the medial side, crosses the knee joint, and is inserted on the medial aspect of the shaft of tibia, along with the Sartorius and along with the gracialis and the semitendinosus. Together we call these three muscles as gyropes. Now, what is the action of Sartorius on the hip and on the knee joint? This is extremely important. Okay, it causes abduction, it causes lateral rotation, and it causes flexion at the hip joint. And what is the action on the knee joint? It causes flexion and medial rotation at the knee joint. Sartorius is known as the honeymoon muscle. Sartorius is also known as a Taylor's muscle or a honeymoon muscle. You understand the actions of this Sartorius, you will understand why it is known as honeymoon muscle. Okay, abduction, lateral rotation and flexion at the hip, flexion and medial rotation at the knee joint, right? This another muscle whose actions are exactly opposite to that of Sartorius. If you can answer this, Sartorius does abduction and lateral rotation at the hip, and this muscle is going to do adduction and medial rotation at the hip joint. Adduction and medial rotation at the hip joint. Any guesses? What is this muscle? This is known as the gracialis. So Sartorius and gracialis have different actions, exactly opposite actions on the hip joint. Remember students, Sartorius क्या करता है? Abduction, lateral rotation. Gracialis does adduction and medial rotation at the hip joint. Gracialis is also known as an anti-rapist muscle. Anti-rapist muscle, whereas Sartorius is known as a honeymoon muscle. Understand the actions on the hip joint, then you'll understand why they are known as like this. Okay, so that's about the Sartorius. Now, what is the action of Sartorius on the knee joint? Flexion and medial rotation. A common action for those three muscles, Sartorius, gracialis and semitendinosus, is flexion and medial rotation at the hip joint. The other muscle in a group of 4, Quadriceps Femoris. One is the Rectus Femoris, Vastus Medialis, Vastus Lateralis, Vastus Intermedius. These three muscles arise from the femur except for Rectus Femoris, which arises from the anterior inferior iliac spine. Okay, so Rectus Femoris is going to cause flexion at the hip and extension at the knee joint. So when you answer actions of Quadriceps Femoris, you would answer it as it causes extension at the knee joint. The Rectus Femoris alone also causes flexion at the hip joint. Flexion at the hip joint. Clear? And where is the insertion of this? They are inserted on the base of the patella, and from the base there's a ligament which begins, named the ligamentum patellae, which is attached to the tibial tuberosity. What is the actions of this muscles? Extension at the knee joint. Extension at the knee joint, and when we extend the knee joint, the lateral condyle of femur articulates with the lateral condyle of tibia, but the medial condyle of femur is larger. For it to articulate, the femur has to undergo a medial rotation, and this is what we call as locking of the knee joint. Clear? So locking of the knee joint is the final Locking of the knee joint is the medial rotation of femur during the final stages of extension when the foot is on the ground. When the foot is on the ground. Clear to all of you? And then I told you about the femoral nerve. Clear? Femoral nerve, largest branch of lumbar plexus. Root value you should know. Trunk, anterior and posterior divisions aane chahiye. Branches from the trunk is the nerve to iliacus and the nerve to pectineus. Anterior division gives one muscular branch to the sartorius. So in the dissection hall, when in the Y-bar, if you are asked what is this muscle, you answer this as sartorius. And then the examiner will ask you what is the nerve supply, right? One student answers it as femoral nerve and the other student answers it as the anterior division of femoral nerve. So obviously he'll get more marks because I know that the student knows the femoral nerve has got anterior and posterior divisions. Clear? So yes, so sartorius is supplied by the anterior division of femoral nerve, which are the two cutaneous branches. Did I show you this? Yes, it supplies the skin on the medial aspect of the thigh. Look at this here, that's the medial aspect of the thigh. It supplies the skin on the medial aspect of the thigh and it supplies the skin on the anterior aspect of the thigh. And this is what we call as the medial femoral cutaneous nerve thigh and the anterior femoral cutaneous nerve thigh. Both are branches of femoral nerve. And what is this? Any idea, any guesses, students, who's going to supply this skin? Skin on the lateral aspect of the thigh, and this is supplied by the lateral femoral cutaneous nerve of thigh, and the lateral femoral cutaneous nerve thigh is a direct branch of lumbar plexus. Look at this, look at this. This lateral femoral cutaneous nerve thigh is a direct branch of lumbar plexus, and this is the nerve which gets compressed against the inguinal ligament, right? This is the nerve which gets compressed because it is coming at the most lateral aspect of the inguinal ligament. Students, are you following this? Look at this nerve. This is the lateral femoral cutaneous nerve thigh, a direct branch of lumbar plexus, and this is the nerve which comes at the most lateral aspect of the inguinal ligament, and this is the nerve which gets compressed against the inguinal ligament. What does the person complain of? Paresthesia, tingling and numbness along the lateral aspect of the thigh, and this is what we call as the meralgia paresthetica. Meralgia paresthetica. This is something very important which you have to know. What is meralgia paresthetica? I'll just put this on the paper for you. Oh, I'm so sorry. What is meralgia paresthetica? One moment. Meralgia paresthetica is the compression of lateral femoral cutaneous nerve of thigh. Lateral femoral cutaneous nerve of thigh against inguinal ligament. It's a compression of the lateral femoral cutaneous nerve thigh against the inguinal ligament. What does the person complain of? The person will complain of paresthesia, tingling and numbness along the lateral aspect of the thigh. Clear? Paresthesia, tingling and numbness along the lateral aspect of the thigh, and this is meralgia paresthetica. Clear, students? Following this? So what I want you to understand is the anterior and the medial femoral cutaneous nerve thigh are direct branches of what? Femoral nerve. Whereas the lateral femoral cutaneous nerve thigh is a branch of lumbar plexus. It's a branch of lumbar plexus. And the posterior division of femoral nerve gives 4 muscular and 1 cutaneous branch. The cutaneous branch is the saphenous nerve, and this saphenous nerve supplies the skin on the medial aspect of the leg and the foot up to the great toe. Medial aspect of the leg and the foot up to the great toe. Okay, medial aspect of the leg and the foot up to the great toe. Clear? I hope this is all clear to all of you. Any doubts? Yes, students, any doubts you have, you can ask me. Bolo. If you have any doubts, you tell me. Yes, Miras, clear no? कुछ doubt है तो बोलो. Students, come on. If you have any doubts, be free to talk, be free to ask. Okay, I'm here to solve your doubts. So this completes my anterior compartment of the thigh and the femoral nerve. A very important topic, a very important viva topic, a very important topic for MCQs and SCQ, the femoral nerve. Sartorius comes as a short note for you. Yes, and Sartorius actions are also very important from the point of view of MCQs. Students, the session is open for doubts and doubt solving. Okay, then I'll stop here. I'll stop here. Thank you to all of you. Thank you to all of you. Thank you to all of you. I hope things are clear. Okay, fine. Thank you. Sam, you joined late? Sam, have you joined late? So this was just an orientation topic, for the anterior compartment of the thigh and the femoral nerve. Did you join late? Okay, that's okay. This was an easy topic, mainly focused on the first year students, but that's okay. Everyone can attend, get an orientation to the femoral nerve and all. What is the root value of obturator nerve? The obturator nerve is formed by the ventral divisions of the ventral rami of L234. The femoral nerve is formed by the dorsal divisions of the ventral rami of L234. That's the only difference, right? Okay, fine. So I'll finish this topic for today. We'll stop then. We'll stop. Okay, thank you. Thank you to all of you. Once again, thank you. Thank you.